All right. Hi, everyone. So I was just sitting at my desk and I was just thinking about when I used to work back in Jamaica as a nurse prior to transition into the US. We don't have computers that we go on and just be clicking and putting your assessment and all of those fine details that you need to put in on your patient. No, and especially at the time when I was working on med surg or med tele floor, we had like a patient ratio of like say 10 to 15 patients to a nurse, because sometimes we only have like either two nurses on that floor and we get things done. And even though we were doing paper charting, it was okay. Let's just say it was okay. We were short staffed like almost every day. Even though to us at that time we probably had enough staff. And I remember we used to be charting, and as I say, it's paper charting we've been doing throughout nursing school and throughout the time, in Jamaica, even up to this date. We're still doing a lot of paper charting back there. And so we would normally be charting on those patients, but because you have so many patients dealing with, you still have assessments to do, you still have medication management or documentations to do, you have procedures that you have to do, and you have to document all of this when you talk to a doctor, what the response was. So technically, the charting doesn't change. So you just have to chart by exception and just make sure you're charting appropriately to cover yourself later on from now. And so I remember some days we're charting because it's either the end of the shift is approaching, or you're supposed to go on lunch, or there's just so many things that you were doing that you were not able to chart, as you go along. And so you're sitting down now, just going ahead and just charting. And I tell you, some days you're charting and your fingers start burning, you have to do something like this because you're charting and the pen is like squeezing on your finger, where you're having a little bit of a numbness or a little bit of a pain because of the amount of pressure that you're applying in order to go ahead and write. And then I'm sitting here laughing and I'm like, but this is no difference with how I go about taking care of my patients, because every now and again I'm charting, and even though I'm charting on the computer, I still have a little bit of inadequacy because I tend to be doing something like this. Punch, punch, punch. Sometimes persons passing by and asking, what you doing? And I'm like, I'm charting. I'm typing. So I'm laughing to myself just now and I'm like, oh, look at that. So for persons who are doing paper charting in their country, I don't want you to feel as though, when you get here, it's going to be anything like super, super concerning where you're not going to be able to function effectively. Your finger bunny when you do paper charting, and I am over here doing pong, 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 trying to get the notes in. But I still move efficiently. So for persons who have experienced paper charting, don't feel as though, coming to the US, you're not going to be able to function. You will still find the two fingers to go ahead and type. Yes, you will still find the two fingers to go ahead and type and get your documentation going. So don't let that be a situation where you're thinking, oh, you're not going to be efficient as a nurse. I always tell people, once you're a nurse, you will always be a nurse. So don't feel as though because charting on paper is the thing in your country, it doesn't mean that because you're going to be charting on a computer now, it doesn't mean that that is going to make you an inefficient person or not competent at your job. Nursing is the same. So regardless of where you're from, where you're trained, whether or not you have a computer system in place or you're doing paper charting, as long as you're documenting by exception, you're documenting the high points for the patient and your shift, that's the most important thing.